Renal colic causes and symptoms. Renal colic is pain that occurs due to a stone in the urinary tract. The urinary tract includes the kidneys, ureters, urinary bladder, and urethra. Stones can develop anywhere in the urinary tract, and they can vary significantly in size. Most stones occur due to a buildup of minerals or other substances, such as uric acid, which stick together in the urine and create a hard mass. There are several treatment options for urinary stones. However, as many stones passes without surgery, the management of renal colic is often the primary concern during treatment. In this video, we explain how to recognize renal colic and what causes it. Symptoms. The symptoms of renal colic vary depending on the size of the stone and its location in the urinary tract. Some small stones cause mild renal colic, and a person can pass them in the urine without much discomfort. Larger stones can cause severe pain, especially if they become stuck and block any small passages in the urinary tract. Susceptible areas include the ureters, which are the tubes through which the urine passes between the kidney and the bladder. The most common presentation of renal colic is pain on the affected side of the body between the lower ribs and hip. This pain tends to radiate to the lower abdomen and groin. The pain typically comes in waves that each last 20 to 60 minutes before subsiding. Renal colic is just one of the symptoms that urinary stones can cause. Other symptoms that commonly occur alongside renal colic include pain or difficulty urinating, blood in the urine, which may make it appear pink, red, or brown, urine that smells unusual, nausea, vomiting, small particles in the urine, feeling a constant urgent need to urinate, cloudy urine, urinating more or less frequently than usual. Symptoms of a related urinary tract infection or UTI may occur for some people. This include fever, chills, and a cold sweat. Anybody experiencing any of these symptoms should talk to a doctor. Anyone experiencing the following symptoms alongside renal colic should contact the emergency medical services or go to the emergency room immediately. A complete inability to urinate, uncontrollable vomiting, a fever higher than 101 degree Fahrenheit. Causes. Renal colic occurs due to a stone becoming lodged in the urinary tract, which commonly occurs in the ureter. Here the stone stretches the surrounding area of tissue while trying to pass through, which can be painful. In addition, restricted urine flow may cause inflammation and increased pressure. The ureter may also spasm, causing pain. Several different chemicals and minerals can make up a kidney stone. Stones develop due to a few different risk factors, including extra calcium in the urine, diseases of the gastrointestinal tract such as Crohn's disease or ulcerative colitis, gout, which occurs due to an excess of uric acid, certain medications, cystinuria, in which stones develop from an amino acid called cysteine, obesity, surgeries of the GI tract such as a gastric bypass, dehydration, a family history of lithiasis. Pain management. Pain management is an essential step in treatment as it can improve a person's quality of life until the stone passes. Doctors may also recommend medications to calm the gastrointestinal tract and manage any nausea and vomiting. Placing a heat pack on the side or lower back may calm the muscle spasms that can occur in people with renal colic. Prevention. Avoiding renal colic starts with preventing the stones that cause the symptoms. A doctor may prescribe a thiazide diuretic if a person has a tendency to develop calcium oxalate urine tract stones. In other cases, they may recommend that people increase their fluid intake and reduce the sodium in their diet. Drinking more fluid may not always improve renal colic or help flush stones out of the urinary tract, but it will, at least prevent dehydration. Many people benefit from eating a healthful diet that is rich in a variety of whole grains, vegetables, fruits, and lean proteins. Doctors may also advise people to increase their intake of citrus fruits such as oranges, lemons, and grapefruits.